1. Hypothyroidism can cause bradycardia. True or false? Answer: true. Rationale: hypothyroidism reduces metabolic rate due to low thyroid hormone levels, slowing heart rate and causing bradycardia, a key symptom requiring monitoring to ensure cardiovascular stability. 2. Type 1 diabetes is caused by insulin resistance. True or false? Answer: false. Rationale: type 1 diabetes results from autoimmune destruction of pancreatic beta cells, leading to insulin deficiency, not resistance, requiring lifelong insulin therapy for glucose control. 3. Hyperthyroidism is associated with weight gain. True or false? Answer: false. Rationale: hyperthyroidism increases metabolism due to excess thyroid hormone, typically causing weight loss, a critical symptom guiding diagnosis and treatment to restore endocrine balance. 4. Administering glucagon is appropriate for an unresponsive patient with hypoglycemia. True or false? Answer: true. Rationale: glucagon raises blood glucose by stimulating glycogenolysis, making it a critical intervention for unresponsive hypoglycemic patients to restore consciousness and ensure safety. 5. Adrenal crisis can be treated with intravenous hydrocortisone. True or false? Answer: true. Rationale: adrenal crisis, caused by acute cortisol deficiency, requires intravenous hydrocortisone to replace cortisol, stabilize hemodynamics, and prevent life-threatening shock. 6. Hemoglobin A1C reflects blood glucose control over the past week. True or false? Answer: false. Rationale: hemoglobin A1C measures average blood glucose over 2 to 3 months, providing a long-term indicator of glycemic control essential for diabetes management and complication prevention. 7. Hyperparathyroidism can cause hypocalcemia. True or false? Answer: false. Rationale: hyperparathyroidism increases parathyroid hormone, elevating blood calcium levels, leading to hypercalcemia, which requires monitoring to prevent neurological complications. 8. Insulin should be administered immediately before meals for type 1 diabetes. True or false? Answer: true. Rationale: rapid-acting insulin given before meals mimics physiological insulin release, controlling postprandial glucose spikes and preventing hyperglycemia in type 1 diabetes. 9. Cushing syndrome is caused by a deficiency of cortisol. True or false? Answer: false. Rationale: Cushing syndrome results from excess cortisol, often due to adrenal or pituitary dysfunction, causing symptoms like weight gain, requiring targeted endocrine interventions. 10. A patient with diabetes insipidus will have concentrated urine. True or false? Answer: false. Rationale: diabetes insipidus, due to antidiuretic hormone deficiency, causes dilute urine from excessive water loss, requiring desmopressin to restore fluid balance and prevent dehydration. 11. Levothyroxine is used to treat hyperthyroidism. True or false? Answer: false. Rationale: levothyroxine treats hypothyroidism by replacing thyroid hormone, while hyperthyroidism requires antithyroid drugs like methimazole to reduce hormone production. 12. Diabetic ketoacidosis is associated with elevated blood pH. True or false? Answer: false. Rationale: diabetic ketoacidosis causes metabolic acidosis with low blood pH due to ketone accumulation, requiring insulin and fluids to correct acid-base imbalance and ensure stability. 13. Pheochromocytoma causes excessive secretion of catecholamines. True or false? Answer: true. Rationale: pheochromocytoma, an adrenal tumor, oversecretes catecholamines, leading to hypertension and tachycardia, requiring surgical and pharmacological management for patient safety. 14. Hypoglycemia can cause seizures in diabetic patients. True or false? Answer: true. Rationale: hypoglycemia deprives the brain of glucose, potentially causing seizures, a neurological emergency requiring rapid glucose administration to prevent harm and ensure safety. 15. The pituitary gland regulates thyroid function through thyroid-stimulating hormone. True or false? Answer: true. Rationale: The pituitary gland secretes thyroid-stimulating hormone to stimulate thyroid hormone production, a key regulatory mechanism assessed in endocrine disorders like hypothyroidism. 16. Hyperaldosteronism can cause hyperkalemia. True or false? Answer: false. Rationale: hyperaldosteronism increases aldosterone, promoting potassium excretion, leading to hypokalemia, which requires monitoring to prevent muscle weakness and cardiac arrhythmias. 17. Patients with type 2 diabetes always require insulin therapy. True or false? Answer: false. Rationale: type 2 diabetes often involves insulin resistance, managed initially with lifestyle changes or oral medications, with insulin reserved for advanced cases to control glucose. 18. Myxedema coma is a complication of untreated hypothyroidism. True or false? Answer: true. Rationale: myxedema coma, a life-threatening hypothyroidism complication, causes hypothermia and coma, requiring urgent intravenous levothyroxine to restore thyroid function and safety. 19. A patient with hyperthyroidism may experience exophthalmos. True or false? Answer: true. Rationale: exophthalmos, or bulging eyes, occurs in hyperthyroidism, particularly Graves' disease, due to orbital tissue inflammation, requiring monitoring to protect vision and comfort. 20. Glucagon is secreted by the beta cells of the pancreas. True or false? Answer: false. Rationale: glucagon is secreted by pancreatic alpha cells to raise blood glucose, while beta cells secrete insulin, a distinction critical for understanding endocrine glucose regulation. 21. Diabetic neuropathy can cause numbness in the extremities. True or false? Answer: true. Rationale: diabetic neuropathy from chronic hyperglycemia damages nerves, causing numbness in extremities, requiring foot care education to prevent injury and ensure safety. 22. Desmopressin is used to treat Cushing's syndrome. True or false? Answer: false. Rationale: desmopressin treats diabetes insipidus by mimicking antidiuretic hormone, while Cushing's syndrome requires cortisol-lowering therapies like ketoconazole or surgery. 23. Hypoparathyroidism can cause tetany. True or false? Answer: true. Rationale: hypoparathyroidism reduces parathyroid hormone, causing hypocalcemia, which leads to tetany, requiring calcium supplementation to prevent neurological complications. 24. Blood glucose monitoring is unnecessary for patients with type 2 diabetes. True or false? Answer: false. Rationale: blood glucose monitoring is essential for type 2 diabetes to guide therapy and prevent complications, ensuring glycemic control and long-term endocrine patient safety. 25. Thyroid storm is a medical emergency requiring immediate intervention. True or false? Answer: true. Rationale: thyroid storm, a severe hyperthyroidism complication, causes life-threatening symptoms like tachycardia, requiring urgent antithyroid drugs and beta blockers to stabilize. 26. Acromegaly is caused by a deficiency of growth hormone. True or false? Answer: false. Rationale: acromegaly results from excess growth hormone, often from a pituitary tumor, causing enlarged features, requiring surgical or pharmacological management to control symptoms. 27. Insulin should be stored at room temperature for long-term use. True or false? Answer: false. Rationale: insulin should be refrigerated for long-term storage to maintain potency, with room temperature use limited to short periods to ensure efficacy and glycemic control. 28. Hypercalcemia is a common finding in Addison's disease. True or false? Answer: false. Rationale: Addison's disease causes cortisol deficiency, not hypercalcemia, which is more associated with hyperparathyroidism, requiring distinct endocrine management strategies. 29. Patients with diabetes insipidus require fluid restriction. True or false? Answer: false. Rationale: diabetes insipidus causes excessive fluid loss, requiring adequate hydration and desmopressin to replace antidiuretic hormone and prevent dehydration-related complications. 30. Methimazole can cause agranulocytosis as a side effect. True or false? Answer: true. Rationale: methimazole, used for hyperthyroidism, can rarely cause agranulocytosis, requiring monitoring of white blood cell counts to ensure patient safety and prevent infections. 31. Diabetic retinopathy is a reversible condition with tight glucose control. True or false? Answer: false. Rationale: diabetic retinopathy, caused by retinal damage, is not fully reversible, but tight glucose control can slow progression, emphasizing early intervention for vision protection. 32. The adrenal gland secretes insulin to regulate blood glucose. True or false? Answer: false. Rationale: the adrenal gland secretes cortisol and catecholamines, while insulin is secreted by the pancreas, a distinction critical for understanding endocrine glucose regulation. 33. Hypothyroidism can cause hair loss. True or false? Answer: true. Rationale: hypothyroidism reduces metabolism, affecting hair follicles and causing hair loss, a symptom requiring thyroid hormone replacement to restore endocrine balance. 34. Administering insulin to a patient with a blood glucose of 50 mg per deciliter is appropriate. True or false? Answer: false. Rationale: a blood glucose of 50 mg per deciliter indicates hypoglycemia, requiring glucose or glucagon, not insulin, to prevent neurological damage and ensure patient safety. 35. Prolactinomas are treated with dopamine agonists like cabergoline. True or false? Answer: true. Rationale: prolactinomas, pituitary tumors causing prolactin excess, respond to dopamine agonists like cabergoline, which reduce prolactin secretion and tumor size effectively. 36. Hyperglycemia can cause polyuria in diabetic patients. True or false? Answer: true. Rationale: hyperglycemia causes osmotic diuresis, leading to polyuria in diabetes, a symptom requiring insulin therapy to control glucose and prevent dehydration complications. 37. Hypophysectomy can lead to diabetes insipidus. True or false? Answer: true. Rationale: hypophysectomy, pituitary gland removal, can disrupt antidiuretic hormone production, causing diabetes insipidus, requiring desmopressin to manage fluid balance. 38. Type 1 diabetes is more common in adults than children. True or false? Answer: false. Rationale: type 1 diabetes, an autoimmune condition, typically presents in childhood or adolescence, requiring insulin therapy, unlike type 2, which is more common in adults. 39. Hyperparathyroidism can cause osteoporosis. True or false? Answer: true. Rationale: hyperparathyroidism increases parathyroid hormone, mobilizing bone calcium, leading to osteoporosis, requiring monitoring to prevent fractures and ensure skeletal health. 40. Patients with Cushing's syndrome are at risk for hyperglycemia. True or false? Answer: true. Rationale: excess cortisol in Cushing's syndrome impairs glucose metabolism, causing hyperglycemia, requiring monitoring to prevent diabetes and ensure metabolic stability. 41. Levothyroxine should be taken with food to enhance absorption. True or false? Answer: false. Rationale: levothyroxine is best taken on an empty stomach to maximize absorption, ensuring effective thyroid hormone replacement and optimal endocrine function. 42. Diabetic ketoacidosis can cause hypokalemia during treatment. True or false? Answer: true. Rationale: insulin therapy for diabetic ketoacidosis drives potassium into cells, causing hypokalemia, requiring potassium supplementation to prevent cardiac arrhythmias. 43. Adrenal crisis is characterized by hypertension. True or false? Answer: false. Rationale: adrenal crisis causes hypotension due to cortisol deficiency, requiring urgent hydrocortisone to restore hemodynamics and ensure patient safety in emergencies. 44. A fasting blood glucose of 126 mg per deciliter or higher confirms diabetes mellitus. True or false? Answer: true. Rationale: A fasting blood glucose of 126 milligrams per deciliter or higher on 2 occasions confirms diabetes, guiding management to prevent complications and ensure endocrine health. 45. Hyperthyroidism can cause atrial fibrillation. True or false? Answer: true. Rationale: hyperthyroidism increases metabolic rate, potentially causing atrial fibrillation due to cardiac overstimulation, requiring antithyroid therapy and cardiac monitoring. 46. Patients with diabetes insipidus have low serum osmolality. True or false? Answer: false. Rationale: diabetes insipidus causes excessive water loss, increasing serum osmolality, requiring desmopressin to restore fluid balance and prevent neurological complications. 47. Type 2 diabetes is primarily caused by autoimmune destruction of beta cells. True or false? Answer: false. Rationale: type 2 diabetes involves insulin resistance and relative insulin deficiency, not autoimmune beta cell destruction, which is characteristic of type 1 diabetes. 48. Hypothyroidism can cause constipation. True or false? Answer: true. Rationale: hypothyroidism slows gastrointestinal motility due to reduced metabolism, causing constipation, requiring thyroid hormone replacement to restore normal function. 49. Administering desmopressin can cause hyponatremia. True or false? Answer: true. Rationale: desmopressin increases water retention in diabetes insipidus, potentially causing hyponatremia, requiring sodium monitoring to ensure electrolyte balance and safety. 50. Cushing's syndrome can cause osteoporosis. True or false? Answer: true. Rationale: excess cortisol in Cushing's syndrome increases bone resorption, causing osteoporosis, requiring monitoring to prevent fractures and ensure skeletal health. 51. Diabetic retinopathy can lead to blindness if untreated. True or false? Answer: true. Rationale: diabetic retinopathy damages retinal blood vessels, potentially causing blindness if untreated, emphasizing the need for tight glucose control and ophthalmologic monitoring. 52. Hypothyroidism is caused by excessive thyroid hormone production. True or false? Answer: false. Rationale: hypothyroidism results from deficient thyroid hormone production, leading to symptoms like fatigue, requiring levothyroxine to restore metabolic balance. 53. Administering insulin is appropriate for a patient with diabetic ketoacidosis. True or false? Answer: true. Rationale: intravenous insulin reduces blood glucose and ketone production in diabetic ketoacidosis, a critical intervention to correct acidosis and ensure patient stability. 54. Pheochromocytoma is a pituitary gland tumor. True or false? Answer: false. Rationale: pheochromocytoma is an adrenal medulla tumor causing catecholamine excess, not a pituitary tumor, requiring distinct diagnostic and surgical management. 55. Hyperparathyroidism can cause kidney stones. True or false? Answer: true. Rationale: hyperparathyroidism increases calcium levels, promoting kidney stone formation, requiring monitoring and possible surgical intervention to prevent renal complications. 56. Type 1 diabetes can be managed with oral hypoglycemic agents alone. True or false? Answer: false. Rationale: type 1 diabetes requires insulin therapy due to absolute insulin deficiency, unlike type 2, which may use oral agents, ensuring effective glycemic control. 57. Graves' disease is a common cause of hyperthyroidism. True or false? Answer: true. Rationale: Graves' disease, an autoimmune condition, causes hyperthyroidism by stimulating thyroid hormone production, requiring antithyroid drugs or surgery for management. 58. Hypoglycemia unawareness is more common in type 2 diabetes than type 1. True or false? Answer: false. Rationale: hypoglycemia unawareness is more common in type 1 diabetes due to frequent glucose fluctuations, requiring careful monitoring to prevent severe episodes. 59. The ACTH stimulation test is used to diagnose Cushing's syndrome. True or false? Answer: false. Rationale. The ACTH stimulation test diagnoses adrenal insufficiency, while Cushing syndrome is confirmed with tests like the dexamethasone suppression test for cortisol excess. 60. Diabetes insipidus can cause hypernatremia. True or false? Answer: true. Rationale. Diabetes insipidus leads to excessive water loss, increasing serum sodium and causing hypernatremia, requiring desmopressin and hydration to restore balance. 61. Levothyroxine can cause weight loss in hypothyroid patients. True or false? Answer: true. Rationale. Levothyroxine restores metabolism in hypothyroidism, often leading to weight loss as a therapeutic effect, requiring monitoring to ensure optimal dosing. 62. Diabetic ketoacidosis is more common in type 2 diabetes than type 1. True or false? Answer: false. Rationale. Diabetic ketoacidosis is more common in type 1 diabetes due to absolute insulin deficiency, requiring urgent insulin and fluid therapy to correct acidosis. 63. Acromegaly can cause diabetes mellitus as a complication. True or false? Answer: true. Rationale. Excess growth hormone in acromegaly impairs insulin sensitivity, causing diabetes mellitus, requiring glucose monitoring and pituitary treatment for management. 64. Patients with Addison's disease are at risk for hypoglycemia. True or false? Answer: true. Rationale. Cortisol deficiency in Addison's disease impairs gluconeogenesis, increasing hypoglycemia risk, requiring glucocorticoid replacement and glucose monitoring. 65. Thyroid storm can be triggered by stress or infection. True or false? Answer: true. Rationale. Thyroid storm, a hyperthyroidism crisis, can be triggered by stress or infection, causing severe symptoms requiring urgent antithyroid drugs and supportive care. 66. Insulin should be administered intravenously for routine diabetes management. True or false? Answer: false. Rationale. Insulin is typically administered subcutaneously for routine diabetes management, with intravenous use reserved for emergencies like diabetic ketoacidosis. 67. Hypoparathyroidism can cause hypercalcemia. True or false? Answer: false. Rationale. Hypoparathyroidism reduces parathyroid hormone, causing hypocalcemia, not hypercalcemia, requiring calcium and vitamin D to prevent neurological complications. 68. A patient with hyperthyroidism may experience insomnia. True or false? Answer: true. Rationale. Hyperthyroidism increases metabolism, causing symptoms like insomnia due to nervous system overstimulation, requiring antithyroid therapy to restore balance. 69. Prolactinomas always require surgical intervention. True or false? Answer: false. Rationale. Prolactinomas are often managed with dopamine agonists like cabergoline, with surgery reserved for non-responsive cases, ensuring effective pituitary control. 70. Diabetic neuropathy can be completely reversed with glucose control. True or false? Answer: false. Rationale. Diabetic neuropathy is not fully reversible, but tight glucose control can slow progression and reduce symptoms, emphasizing preventive foot care for safety. 71. Desmopressin is used to treat type 1 diabetes. True or false? Answer: false. Rationale. Desmopressin treats diabetes insipidus by mimicking antidiuretic hormone, while type 1 diabetes requires insulin to manage glucose levels effectively. 72. Hyperaldosteronism can cause muscle weakness. True or false? Answer: true. Rationale. Hyperaldosteronism causes hypokalemia, leading to muscle weakness, requiring potassium supplementation and aldosterone antagonists to ensure patient stability. 73. Hypothyroidism can cause goiter formation. True or false? Answer: true. Rationale. Hypothyroidism, particularly from iodine deficiency, can cause goiter as the thyroid enlarges to compensate, requiring thyroid hormone replacement for management. 74. Administering glucagon to a patient with hyperglycemia is appropriate. True or false? Answer: false. Rationale. Glucagon is used for hypoglycemia to raise blood glucose, not hyperglycemia, which requires insulin to lower glucose and prevent metabolic complications. 75. Cushing's syndrome can cause hypertension. True or false? Answer: true. Rationale: excess cortisol in Cushing's syndrome increases blood pressure through sodium retention, requiring monitoring and treatment to prevent cardiovascular complications. 76. Diabetes insipidus is caused by insulin deficiency. True or false? Answer: false. Rationale: diabetes insipidus results from antidiuretic hormone deficiency or resistance, not insulin deficiency, requiring desmopressin to manage fluid balance. 77. Methimazole is used to treat hypothyroidism. True or false? Answer: false. Rationale: methimazole treats hyperthyroidism by inhibiting thyroid hormone synthesis, while hypothyroidism requires levothyroxine to replace deficient hormone. 78. Diabetic ketoacidosis can cause dehydration. True or false? Answer: true. Rationale: diabetic ketoacidosis causes osmotic diuresis from hyperglycemia, leading to dehydration, requiring intravenous fluids to restore volume and ensure stability. 79. Acromegaly can cause joint pain. True or false? Answer: true. Rationale: excess growth hormone in acromegaly causes joint overgrowth, leading to pain, requiring pituitary treatment and symptom management to improve quality of life. 80. Patients with type 1 diabetes are at risk for hyperosmolar, hyperglycemic state. True or false? Answer: false. Rationale: hyperosmolar hyperglycemic state is more common in type 2 diabetes, while type 1 diabetes is associated with diabetic ketoacidosis due to insulin deficiency. 81. Hypothyroidism can cause depression. True or false? Answer: true. Rationale: hypothyroidism slows metabolism, affecting neurotransmitter function and causing depression, requiring thyroid hormone replacement to improve mental health. 82. Administering hydrocortisone can cause hyperglycemia. True or false? Answer: true. Rationale: hydrocortisone, a glucocorticoid, increases blood glucose by promoting gluconeogenesis, requiring monitoring in patients with diabetes or adrenal disorders. 83. Hyperparathyroidism can cause fatigue. True or false? Answer: true. Rationale: hyperparathyroidism causes hypercalcemia, leading to fatigue and weakness, requiring calcium management and possible parathyroid surgery for symptom relief. 84. Insulin pens should be refrigerated after opening. True or false? Answer: false. Rationale: insulin pens can be stored at room temperature after opening for up to a month, ensuring convenience while maintaining efficacy for glycemic control. 85. Thyroid storm can cause fever. True or false? Answer: true. Rationale: thyroid storm, a hyperthyroidism crisis, causes fever due to excessive metabolic activity, requiring urgent cooling measures and antithyroid drugs for stabilization. 86. Addison's disease can cause hyperpigmentation. True or false? Answer: true. Rationale: Addison's disease increases ACTH due to cortisol deficiency, stimulating melanocytes and causing hyperpigmentation, a key diagnostic clue requiring hormone replacement. 87. Type 2 diabetes is always associated with obesity. True or false? Answer: false. Rationale: while obesity is a risk factor, type 2 diabetes can occur in non-obese individuals due to genetic or other factors, requiring individualized management plans. 88. Hypoglycemia can cause diaphoresis. True or false? Answer: true. Rationale: hypoglycemia triggers sympathetic activation, causing diaphoresis, a warning sign requiring rapid glucose administration to prevent neurological harm. 89. Prolactinomas can cause infertility in women. True or false? Answer: true. Rationale: excess prolactin from prolactinomas disrupts ovulation, causing infertility, requiring dopamine agonists to restore reproductive function and hormonal balance. 90. Diabetic foot ulcers are caused by poor wound healing. True or false? Answer: True. Rationale. Poor wound healing in diabetes, due to neuropathy and poor circulation, causes foot ulcers, requiring meticulous wound care to prevent infection and amputation. 91. Desmopressin can cause hypertension. True or false? Answer. True. Rationale. Desmopressin increases water retention, potentially raising blood pressure, requiring monitoring to ensure cardiovascular safety in diabetes insipidus treatment. 92. Hyperthyroidism can cause weight loss despite increased appetite. True or false? Answer. True. Rationale. Hyperthyroidism accelerates metabolism, causing weight loss despite increased appetite, a hallmark symptom requiring antithyroid therapy to restore balance. 93. Hypoparathyroidism can cause seizures. True or false? Answer. True. Rationale. Hypoparathyroidism causes hypocalcemia, lowering seizure threshold and causing seizures, requiring calcium and vitamin D to stabilize neurological function. 94. Administering insulin to a patient with a blood glucose of 200 milligrams per deciliter post-meal is always necessary. True or false? Answer. False. Rationale. A post-meal glucose of 200 milligrams per deciliter may not require immediate insulin, depending on the patient's plan, emphasizing monitoring and individualized therapy for control. 95. Cushing syndrome can cause muscle weakness. True or false? Answer. True. Rationale. Excess cortisol in Cushing syndrome causes protein catabolism, leading to muscle weakness, requiring cortisol-lowering therapies to improve strength and function. 96. Diabetes insipidus can cause concentrated urine. True or false? Answer. False. Rationale. Diabetes insipidus causes dilute urine due to antidiuretic hormone deficiency, requiring desmopressin to reduce water loss and prevent dehydration. 97. Levothyroxine can cause tachycardia as a side effect. True or false? Answer. True. Rationale. Excessive levothyroxine can mimic hyperthyroidism, causing tachycardia, requiring dose adjustments and monitoring to ensure cardiovascular and endocrine safety. 98. Diabetic ketoacidosis can cause abdominal pain. True or false? Answer. True. Rationale. Diabetic ketoacidosis causes metabolic acidosis, leading to abdominal pain, requiring insulin and fluids to correct acidosis and alleviate symptoms. 99. Acromegaly can cause hypertension. True or false? Answer. True. Rationale. Excess growth hormone in acromegaly increases vascular resistance, causing hypertension, requiring pituitary treatment and blood pressure monitoring for safety. 100. Patients with type 1 diabetes can develop insulin resistance. True or false? Answer. True. Rationale. While rare, type 1 diabetes patients can develop insulin resistance, often due to obesity or stress, requiring adjusted insulin regimens to maintain glycemic control. 101. Hypothyroidism can cause cold intolerance. True or false? Answer. True. Rationale. Hypothyroidism reduces metabolic rate, impairing heat production and causing cold intolerance, requiring thyroid hormone replacement to restore thermoregulation. 102. Type 1 diabetes is managed primarily with lifestyle changes. True or false? Answer. False. Rationale. Type 1 diabetes requires insulin therapy due to absolute insulin deficiency, with lifestyle changes as an adjunct, ensuring effective glycemic control and safety. 103. Hyperthyroidism can cause diarrhea. True or false? Answer. True. Rationale. Hyperthyroidism accelerates gastrointestinal motility due to increased metabolism, causing diarrhea, requiring antithyroid therapy to normalize bowel function. 104. Glucagon should be administered to a patient with a blood glucose of 300 milligrams per deciliter. True or false? Answer. False. Rationale. Glucagon is used for hypoglycemia, not hyperglycemia, which requires insulin to lower blood glucose and prevent complications like ketoacidosis. 105. Adrenal crisis can cause hypernatremia. True or false? Answer. False. Rationale. Adrenal crisis causes hyponatremia due to aldosterone deficiency, leading to sodium loss, requiring hydrocortisone and fluids to restore electrolyte balance. 106. Hemoglobin A1C is used to diagnose acute hypoglycemia. True or false? Answer: false. Rationale: hemoglobin A1C monitors long-term glucose control, not acute hypoglycemia, which requires immediate blood glucose testing and carbohydrate administration. 107. Hyperparathyroidism can cause bone pain. True or false? Answer: true. Rationale: hyperparathyroidism increases bone resorption due to elevated parathyroid hormone, causing bone pain, requiring calcium management to prevent skeletal damage. 108. Insulin is contraindicated in patients with type 2 diabetes. True or false? Answer: false. Rationale: insulin is used in type 2 diabetes when oral medications fail, helping control hyperglycemia and prevent complications, tailored to individual patient needs. 109. Cushing syndrome can cause hypokalemia. True or false? Answer: true. Rationale: excess cortisol in Cushing syndrome promotes potassium excretion, causing hypokalemia, requiring monitoring to prevent muscle weakness and cardiac issues. 110. Diabetes insipidus is associated with low urine output. True or false? Answer: false. Rationale: diabetes insipidus causes high urine output due to antidiuretic hormone deficiency, requiring desmopressin to reduce water loss and prevent dehydration. 111. Methimazole is used to treat thyroid storm. True or false? Answer: true. Rationale: methimazole inhibits thyroid hormone synthesis, a critical intervention in thyroid storm to reduce metabolic rate and stabilize life-threatening symptoms. 112. Diabetic ketoacidosis is treated with oral glucose. True or false? Answer: false. Rationale: diabetic ketoacidosis requires intravenous insulin and fluids to correct hyperglycemia and acidosis, not oral glucose, which would worsen the condition. 113. Pheochromocytoma can cause palpitations. True or false? Answer: true. Rationale: catecholamine excess in pheochromocytoma causes palpitations due to sympathetic overstimulation, requiring alpha blockers and surgical management for control. 114. Hypoglycemia can cause confusion in diabetic patients. True or false? Answer: true. Rationale: hypoglycemia impairs brain glucose supply, causing confusion, requiring rapid carbohydrate administration to restore neurological function and ensure safety. 115. The thyroid gland secretes growth hormone. True or false? Answer: false. Rationale: the thyroid gland secretes thyroid hormone, while growth hormone is secreted by the pituitary gland, a distinction critical for endocrine disorder management. 116. Hyperaldosteronism can cause edema. True or false? Answer: true. Rationale: hyperaldosteronism increases sodium retention, leading to fluid accumulation and edema, requiring aldosterone antagonists to manage fluid balance. 117. Type 2 diabetes can be reversed with weight loss in some cases. True or false? Answer: true. Rationale: weight loss improves insulin sensitivity in type 2 diabetes, potentially reversing early disease, emphasizing lifestyle interventions for glycemic control. 118. Myxedema coma can cause hypertension. True or false? Answer: false. Rationale: myxedema coma, a hypothyroidism emergency, causes hypotension due to reduced metabolism, requiring levothyroxine and supportive care to stabilize hemodynamics. 119. Hyperthyroidism can cause hair thinning. True or false? Answer: true. Rationale: hyperthyroidism disrupts hair growth cycles due to increased metabolism, causing thinning, requiring antithyroid therapy to restore endocrine balance and hair health. 120. Glucagon is secreted by pancreatic beta cells. True or false? Answer: false. Rationale: glucagon is secreted by pancreatic alpha cells to raise blood glucose, while beta cells secrete insulin, critical for understanding glucose regulation. 121. Diabetic neuropathy can cause foot ulcers. True or false? Answer: true. Rationale: diabetic neuropathy reduces sensation, increasing injury risk and causing foot ulcers, requiring meticulous foot care to prevent infection and amputation. 122. Desmopressin is used to treat diabetic ketoacidosis. True or false? Answer: false. Rationale: desmopressin treats diabetes insipidus, while diabetic ketoacidosis requires insulin and fluids to correct hyperglycemia and acidosis, not desmopressin. 123. Hypoparathyroidism can cause muscle cramps. True or false? Answer: true. Rationale: hypoparathyroidism causes hypocalcemia, leading to muscle cramps, requiring calcium and vitamin D supplementation to prevent neurological complications. 124. Blood glucose monitoring is critical for type 1 diabetes management. True or false? Answer: true. Rationale: frequent blood glucose monitoring guides insulin dosing in type 1 diabetes, preventing hypo and hyperglycemia to ensure long-term patient safety. 125. Thyroid storm is a complication of hypothyroidism. True or false? Answer: false. Rationale: thyroid storm is a life-threatening complication of hyperthyroidism, not hypothyroidism, requiring urgent antithyroid drugs and beta blockers for stabilization. 126. Acromegaly can cause vision changes. True or false? Answer: true. Rationale: acromegale's pituitary tumor can compress the optic chiasm, causing vision changes, requiring imaging and treatment to prevent permanent visual loss. 127. Insulin should be shaken vigorously before administration. True or false? Answer: false. Rationale: insulin should be gently rolled, not shaken, to avoid denaturing, ensuring potency and effective glycemic control for diabetes management. 128. Addison's disease can cause hyponatremia. True or false? Answer: true. Rationale: Addison's disease reduces aldosterone, causing sodium loss and hyponatremia, requiring glucocorticoid and mineralocorticoid replacement for electrolyte balance. 129. Patients with diabetes insipidus require high-sodium diets. True or false? Answer: false. Rationale: diabetes insipidus requires adequate hydration, not high-sodium diets, to compensate for water loss and prevent hypernatremia-related complications. 130. Propylthiouracil can cause liver toxicity as a side effect. True or false? Answer: true. Rationale: propylthiouracil, used for hyperthyroidism, can cause liver toxicity, requiring regular liver function monitoring to ensure patient safety during treatment. 131. Diabetic retinopathy can be prevented with tight glucose control. True or false? Answer: true. Rationale: tight glucose control reduces retinal damage risk in diabetic retinopathy, emphasizing early intervention and regular eye exams to protect vision. 132. The adrenal gland secretes thyroid hormone. True or false? Answer: false. Rationale: the adrenal gland secretes cortisol and catecholamines, while thyroid hormone is secreted by the thyroid gland, critical for accurate endocrine management. 133. Hypothyroidism can cause dry skin. True or false? Answer: true. Rationale: hypothyroidism reduces sweat and oil production, causing dry skin, requiring thyroid hormone replacement to restore skin integrity and patient comfort. 134. Administering insulin to a patient with a blood glucose of 70 mg per deciliter is appropriate. True or false? Answer: false. Rationale: a blood glucose of 70 mg per deciliter is normal or near hypoglycemic, requiring monitoring or carbohydrates, not insulin, to prevent dangerous glucose drops. 135. Prolactinomas can cause galactorrhea in men. True or false? Answer: true. Rationale: excess prolactin from prolactinomas can cause galactorrhea in men, requiring dopamine agonists to reduce prolactin and restore hormonal balance. 136. Hyperglycemia can cause fatigue in diabetic patients. True or false? Answer: true. Rationale: hyperglycemia impairs cellular energy use, causing fatigue, requiring insulin or oral agents to control glucose and improve patient energy levels. 137. Hypophysectomy can cause hypothyroidism. True or false? Answer: true. Rationale: hypophysectomy removes the pituitary, reducing thyroid-stimulating hormone and causing hypothyroidism, requiring levothyroxine to maintain thyroid function. 138. Type 1 diabetes is caused by insulin resistance. True or false? Answer: false. Rationale: type 1 diabetes results from autoimmune beta cell destruction, not insulin resistance, requiring insulin therapy, unlike type 2 diabetes management. 139. Hyperparathyroidism can cause constipation. True or false? Answer: true. Rationale: hyperparathyroidism causes hypercalcemia, slowing gastrointestinal motility and causing constipation, requiring calcium management for symptom relief. 140. Cushing syndrome can cause weight loss. True or false? Answer: false. Rationale: Cushing syndrome causes weight gain due to cortisol excess, promoting fat deposition, requiring cortisol-lowering therapies to manage obesity risks. 141. Levothyroxine should be taken at bedtime for optimal efficacy. True or false? Answer: true. Rationale: taking levothyroxine at bedtime, away from food, enhances absorption, ensuring effective thyroid hormone replacement and optimal endocrine function. 142. Diabetic ketoacidosis can cause hyperkalemia initially. True or false? Answer: true. Rationale: diabetic ketoacidosis causes initial hyperkalemia due to acidosis shifting potassium extracellularly, requiring careful monitoring during insulin therapy. 143. Adrenal crisis can cause fever. True or false? Answer: false. Rationale: adrenal crisis causes hypothermia due to cortisol deficiency, not fever, requiring hydrocortisone to restore metabolic function and stabilize temperature. 144. A random blood glucose of 200 mg per deciliter with symptoms confirms diabetes mellitus. True or false? Answer: true. Rationale: a random blood glucose of 200 mg per deciliter with symptoms like polyuria confirms diabetes, guiding immediate management to prevent endocrine complications. 145. Hyperthyroidism can cause muscle weakness. True or false? Answer: true. Rationale: hyperthyroidism causes muscle catabolism due to increased metabolism, leading to weakness, requiring antithyroid therapy to restore muscle strength. 146. Patients with diabetes insipidus have high urine osmolality. True or false? Answer: false. Rationale: diabetes insipidus causes low urine osmolality due to dilute urine from water loss, requiring desmopressin to concentrate urine and prevent dehydration. 147. Type 2 diabetes can cause diabetic ketoacidosis. True or false? Answer: true. Rationale: though rare, type 2 diabetes can cause diabetic ketoacidosis in severe stress or illness, requiring insulin and fluids to correct acidosis and ensure stability. 148. Hypothyroidism can cause menstrual irregularities. True or false? Answer: true. Rationale: hypothyroidism disrupts reproductive hormones, causing menstrual irregularities, requiring thyroid hormone replacement to restore normal cycles. 149. Administering desmopressin can cause fluid overload. True or false? Answer: true. Rationale: desmopressin increases water retention, risking fluid overload, requiring careful monitoring to ensure fluid balance and cardiovascular safety in treatment. 150. Cushing syndrome can cause diabetes mellitus. True or false? Answer: true. Rationale: excess cortisol in Cushing syndrome impairs glucose metabolism, causing diabetes mellitus, requiring glucose monitoring and cortisol-lowering therapies. 151. Hyperthyroidism can cause goiter formation. True or false? Answer: true. Rationale: hyperthyroidism, especially in Graves' disease, can cause goiter due to thyroid overstimulation, requiring antithyroid therapy to reduce gland size and function. 152. Type 1 diabetes can be cured with insulin therapy. True or false? Answer: false. Rationale: type 1 diabetes is managed, not cured, with insulin therapy, as it results from permanent beta cell destruction, requiring lifelong treatment for glycemic control. 153. Hypothyroidism can cause weight loss. True or false? Answer: false. Rationale: hypothyroidism reduces metabolism, leading to weight gain, not loss, requiring levothyroxine to restore metabolic rate and manage body weight effectively. 154. Glucagon can be administered orally for hypoglycemia. True or false? Answer: false. Rationale: glucagon is administered intramuscularly or subcutaneously for hypoglycemia, as oral administration is ineffective, ensuring rapid glucose elevation in emergencies. 155. Adrenal crisis can cause hypoglycemia. True or false? Answer: true. Rationale: adrenal crisis reduces cortisol, impairing gluconeogenesis and causing hypoglycemia, requiring hydrocortisone to restore glucose levels and prevent complications. 156. Hemoglobin A1C should be checked daily in diabetic patients. True or false? Answer: false. Rationale: hemoglobin A1C is checked every 3 to 6 months to assess long-term glucose control, not daily, which relies on fingerstick glucose monitoring for immediate management. 157. Hyperparathyroidism can cause seizures. True or false? Answer: false. Rationale: hyperparathyroidism causes hypercalcemia, not seizures, which are more associated with hypocalcemia from hypoparathyroidism, requiring distinct management. 158. Insulin is required for all patients with gestational diabetes. True or false? Answer: false. Rationale: gestational diabetes is often managed with diet and exercise, with insulin used only if glycemic control is inadequate, ensuring maternal and fetal safety. 159. Cushing syndrome can cause osteoporosis. True or false? Answer: true. Rationale: excess cortisol in Cushing syndrome increases bone resorption, causing osteoporosis, requiring monitoring and cortisol-lowering therapies to prevent fractures. 160. Diabetes insipidus can cause dehydration. True or false? Answer: true. Rationale: diabetes insipidus causes excessive water loss due to antidiuretic hormone deficiency, leading to dehydration, requiring desmopressin and hydration for balance. 161. Propylthiouracil is used to treat hypothyroidism. True or false? Answer: false. Rationale: propylthiouracil treats hyperthyroidism by inhibiting thyroid hormone synthesis, while hypothyroidism requires levothyroxine to replace deficient hormone. 162. Diabetic ketoacidosis can cause fruity breath odor. True or false? Answer: true. Rationale: diabetic ketoacidosis produces ketones, causing fruity breath odor, a diagnostic clue requiring insulin and fluids to reverse acidosis and restore stability. 163. Pheochromocytoma can cause weight gain. True or false? Answer: false. Rationale: pheochromocytoma causes weight loss due to catecholamine-induced metabolism increase, requiring surgical removal to manage symptoms and prevent complications. 164. Hypoglycemia can cause tremors in diabetic patients. True or false? Answer: true. Rationale: hypoglycemia triggers sympathetic activation, causing tremors, requiring rapid carbohydrate administration to restore glucose and prevent neurological harm. 165. The pituitary gland secretes aldosterone. True or false? Answer: false. Rationale: the pituitary gland secretes ACTH, which stimulates aldosterone production by the adrenal gland, a distinction critical for endocrine disorder management. 166. Hyperaldosteronism can cause hypertension. True or false? Answer: true. Rationale: hyperaldosteronism increases sodium retention, raising blood pressure, requiring aldosterone antagonists to manage hypertension and cardiovascular risks. 167. Type 2 diabetes can be managed with metformin. True or false? Answer: true. Rationale: metformin improves insulin sensitivity in type 2 diabetes, a first-line treatment to control glucose and prevent complications, tailored to patient needs. 168. Myxedema coma can cause hypothermia. True or false? Answer: true. Rationale: myxedema coma, a hypothyroidism emergency, reduces metabolism, causing hypothermia, requiring levothyroxine and warming measures to stabilize temperature. 169. Hyperthyroidism can cause fatigue. True or false? Answer: true. Rationale: hyperthyroidism overstimulates the body, leading to fatigue from energy depletion, requiring antithyroid therapy to restore endocrine balance and energy levels. 170. Insulin is secreted by pancreatic alpha cells. True or false? Answer: false. Rationale: insulin is secreted by pancreatic beta cells, while alpha cells secrete glucagon, critical for understanding glucose regulation in endocrine disorders. 171. Diabetic neuropathy can cause loss of sensation. True or false? Answer: true. Rationale: diabetic neuropathy damages nerves, causing loss of sensation, increasing injury risk, and requiring foot care education to prevent complications like ulcers. 172. Desmopressin is used to treat Cushing's disease. True or false? Answer: false. Rationale: desmopressin treats diabetes insipidus, while Cushing's disease requires cortisol-lowering therapies like surgery or ketoconazole to manage excess cortisol. 173. Hypoparathyroidism can cause tingling in extremities. True or false? Answer: true. Rationale: hypoparathyroidism causes hypocalcemia, leading to tingling from nerve irritability, requiring calcium supplementation to prevent neurological complications. 174. Blood glucose monitoring is unnecessary for prediabetes management. True or false? Answer: false. Rationale: blood glucose monitoring helps track prediabetes progression, guiding lifestyle changes to prevent type 2 diabetes and ensure long-term endocrine health. 175. Thyroid storm can cause coma. True or false? Answer: true. Rationale: thyroid storm, a hyperthyroidism crisis, can cause coma due to metabolic overload, requiring urgent antithyroid drugs and supportive care to prevent death. 176. Acromegaly can cause heart enlargement. True or false? Answer: true. Rationale: excess growth hormone in acromegaly causes cardiac hypertrophy, increasing heart size, requiring pituitary treatment to prevent cardiovascular complications. 177. Insulin should be injected into scar tissue for optimal absorption. True or false? Answer: false. Rationale: insulin should be injected into healthy tissue, as scar tissue impairs absorption, reducing efficacy and complicating glycemic control in diabetes management. 178. Addison's disease can cause hypotension. True or false? Answer: true. Rationale: Addison's disease reduces cortisol and aldosterone, causing hypotension from sodium loss, requiring hormone replacement to stabilize blood pressure. 179. Patients with diabetes insipidus require fluid restriction. True or false? Answer: false. Rationale: diabetes insipidus causes water loss, requiring adequate hydration and desmopressin to prevent dehydration and maintain fluid balance safely. 180. Methimazole can cause rash as a side effect. True or false? Answer: true. Rationale: methimazole, used for hyperthyroidism, can cause rash, requiring monitoring and possible drug change to ensure patient safety and treatment adherence. 181. Diabetic retinopathy can cause floaters in vision. True or false? Answer: true. Rationale: diabetic retinopathy causes retinal hemorrhages, leading to floaters, requiring tight glucose control and ophthalmologic intervention to preserve vision. 182. The adrenal gland secretes antidiuretic hormone. True or false? Answer: false. Rationale: the adrenal gland secretes cortisol and catecholamines, while antidiuretic hormone is secreted by the pituitary, critical for accurate endocrine management. 183. Hypothyroidism can cause memory impairment. True or false? Answer: true. Rationale: hypothyroidism slows brain metabolism, causing memory impairment, requiring levothyroxine to restore cognitive function and improve quality of life. 184. Administering insulin to a patient with a blood glucose of 90 mg per deciliter is always appropriate. True or false? Answer: false. Rationale: a blood glucose of 90 mg per deciliter is normal, and insulin may not be needed, depending on the patient's plan, to avoid hypoglycemia and ensure safety. 185. Prolactinomas can cause headaches. True or false? Answer: true. Rationale: prolactinomas, pituitary tumors, can cause headaches from mass effect, requiring dopamine agonists or surgery to relieve pressure and manage symptoms. 186. Hyperglycemia can cause thirst in diabetic patients. True or false? Answer: true. Rationale: hyperglycemia causes osmotic diuresis, leading to thirst from dehydration, requiring insulin to control glucose and restore fluid balance. 187. Hypophysectomy can cause adrenal insufficiency. True or false? Answer: true. Rationale: hypophysectomy removes the pituitary, reducing ACTH and causing adrenal insufficiency, requiring cortisol replacement to maintain endocrine function. 188. Type 1 diabetes can cause hyperosmolar hyperglycemic state. True or false? Answer: false. Rationale: hyperosmolar hyperglycemic state is typical of type 2 diabetes, while type 1 diabetes is more associated with diabetic ketoacidosis due to insulin deficiency. 189. Hyperparathyroidism can cause abdominal pain. True or false? Answer: true. Rationale: hyperparathyroidism causes hypercalcemia, leading to abdominal pain from pancreatitis or ulcers, requiring calcium management to alleviate symptoms. 190. Cushing syndrome can cause hirsutism. True or false? Answer: true. Rationale: excess cortisol in Cushing syndrome increases androgen production, causing hirsutism, requiring cortisol-lowering therapies to manage symptoms. 191. Levothyroxine can cause hair loss as a side effect. True or false? Answer: false. Rationale: levothyroxine treats hypothyroidism, which causes hair loss, and proper dosing improves hair growth, not worsens it, ensuring endocrine balance. 192. Diabetic ketoacidosis can cause rapid breathing. True or false? Answer: true. Rationale: diabetic ketoacidosis causes Kussmaul respirations to compensate for acidosis, requiring insulin and fluids to correct pH and stabilize breathing. 193. Adrenal crisis can cause hyperkalemia. True or false? Answer: true. Rationale: adrenal crisis reduces aldosterone, causing potassium retention and hyperkalemia, requiring hydrocortisone and fluids to restore electrolyte balance. 194. A fasting blood glucose of 100 mg per deciliter confirms diabetes mellitus. True or false? Answer: false. Rationale: a fasting blood glucose of 126 mg per deciliter or higher confirms diabetes, while 100 to 125 mg/dl indicates prediabetes, guiding appropriate management. 195. Hyperthyroidism can cause anxiety. True or false? Answer: true. Rationale: hyperthyroidism increases metabolism, stimulating the nervous system and causing anxiety, requiring antithyroid therapy to restore emotional stability. 196. Patients with diabetes insipidus have low serum sodium. True or false? Answer: false. Rationale: diabetes insipidus causes water loss, increasing serum sodium, hypernatremia, requiring desmopressin to restore fluid balance and normalize sodium. 197. Type 2 diabetes can be managed with insulin pumps. True or false? Answer: true. Rationale: insulin pumps can be used in type 2 diabetes for intensive insulin therapy when oral agents fail, ensuring precise glycemic control and patient safety. 198. Hypothyroidism can cause bradycardia. True or false? Answer: true. Rationale: hypothyroidism slows metabolism, reducing heart rate and causing bradycardia, requiring levothyroxine to restore cardiovascular function and stability. 199. Administering desmopressin can cause seizures. True or false? Answer: true. Rationale: desmopressin can cause hyponatremia from excessive water retention, lowering seizure threshold, requiring sodium monitoring to ensure neurological safety. 200. Cushing syndrome can cause moon phases. True or false? Answer: true. Rationale: excess cortisol in Cushing syndrome causes fat redistribution, leading to moon phases, requiring cortisol-lowering therapies to manage physical changes. 201. Hyperthyroidism can cause increased appetite. True or false? Answer: true. Rationale: hyperthyroidism increases metabolism, leading to increased appetite as the body demands more energy, requiring antithyroid therapy to normalize hunger signals. 202. Type 1 diabetes can be prevented with lifestyle changes. True or false? Answer: false. Rationale: type 1 diabetes is an autoimmune condition not preventable by lifestyle changes, unlike type 2, requiring insulin therapy for lifelong glycemic control. 203. Hypothyroidism can cause elevated cholesterol levels. True or false? Answer: true. Rationale: hypothyroidism reduces lipid metabolism, causing elevated cholesterol, requiring levothyroxine to restore thyroid function and lower cardiovascular risk. 204. Glucagon is effective in treating hyperglycemia. True or false? Answer: false. Rationale: glucagon raises blood glucose and is used for hypoglycemia, not hyperglycemia, which requires insulin to lower glucose and prevent metabolic complications. 205. Adrenal crisis can cause abdominal pain. True or false? Answer: true. Rationale: adrenal crisis causes cortisol deficiency, leading to abdominal pain from electrolyte imbalances, requiring hydrocortisone to stabilize symptoms and prevent shock. 206. Hemoglobin A1C levels below 7% indicate poor diabetes control. True or false? Answer: false. Rationale: hemoglobin A1C below 7% indicates good diabetes control, reducing complication risks, with individualized targets ensuring optimal glycemic management. 207. Hyperparathyroidism can cause muscle weakness. True or false? Answer: true. Rationale: hyperparathyroidism causes hypercalcemia, leading to muscle weakness, requiring calcium management and possible parathyroid surgery to restore strength. 208. Insulin can be administered orally for diabetes management. True or false? Answer: false. Rationale: insulin is degraded in the stomach and must be administered subcutaneously or intravenously, ensuring effective glucose control in diabetes management. 209. Cushing syndrome can cause stretch marks. True or false? Answer: true. Rationale: excess cortisol in Cushing syndrome weakens skin collagen, causing stretch marks, requiring cortisol-lowering therapies to manage skin and metabolic changes. 210. Diabetes insipidus can cause polydipsia. True or false? Answer: true. Rationale: diabetes insipidus causes excessive water loss, triggering polydipsia to compensate for dehydration, requiring desmopressin to restore fluid balance. 211. Levothyroxine is used to treat Graves' disease. True or false? Answer: false. Rationale: levothyroxine treats hypothyroidism, while Graves' disease, a cause of hyperthyroidism, requires antithyroid drugs like methimazole to reduce hormone production. 212. Diabetic ketoacidosis can cause coma. True or false? Answer: true. Rationale: severe diabetic ketoacidosis causes profound acidosis, leading to coma, requiring urgent insulin and fluids to reverse acidosis and restore consciousness. 213. Pheochromocytoma can cause sweating. True or false? Answer: true. Rationale: Catecholamine excess in pheochromocytoma causes sweating from sympathetic activation, requiring alpha blockers and surgery to manage symptoms and risks. 214. Hypoglycemia can cause irritability in diabetic patients. True or false? Answer: true. Rationale: hypoglycemia impairs brain glucose supply, causing irritability, requiring rapid carbohydrate administration to restore neurological function and mood stability. 215. The thyroid gland secretes parathyroid hormone. True or false? Answer: false. Rationale: the thyroid gland secretes thyroid hormone and calcitonin, while parathyroid hormone is secreted by the parathyroid glands, critical for calcium regulation. 216. Hyperaldosteronism can cause hypokalemia. True or false? Answer: true. Rationale: hyperaldosteronism promotes potassium excretion, causing hypokalemia, requiring potassium supplementation and aldosterone antagonists to prevent complications. 217. Type 2 diabetes can be managed with diet alone in some cases. True or false? Answer: true. Rationale: early type 2 diabetes can be managed with diet and exercise to improve insulin sensitivity, preventing progression, and ensuring glycemic control. 218. Myxedema coma can cause respiratory failure. True or false? Answer: true. Rationale: myxedema coma reduces metabolism, causing hypoventilation and respiratory failure, requiring levothyroxine and ventilatory support to stabilize breathing. 219. Hyperthyroidism can cause heat intolerance. True or false? Answer: true. Rationale: hyperthyroidism increases metabolism, impairing heat dissipation and causing heat intolerance, requiring antithyroid therapy to restore thermoregulation. 220. Glucagon is secreted by pancreatic islet cells. True or false? Answer: true. Rationale: glucagon is secreted by pancreatic alpha islet cells to raise blood glucose, a critical function in glucose homeostasis and endocrine disorder management. 221. Diabetic neuropathy can cause pain in extremities. True or false? Answer: true. Rationale: diabetic neuropathy causes nerve damage, leading to neuropathic pain in extremities, requiring glucose control and pain management to improve quality of life. 222. Desmopressin is used to treat hyperthyroidism. True or false? Answer: false. Rationale: desmopressin treats diabetes insipidus, while hyperthyroidism requires antithyroid drugs like propylthiouracil to reduce excessive thyroid hormone production. 223. Hypoparathyroidism can cause chvostexine. True or false? Answer: true. Rationale: hypoparathyroidism causes hypocalcemia, leading to chvostexine, facial twitching, requiring calcium supplementation to prevent neurological complications. 224. Blood glucose monitoring is essential for insulin pump users. True or false? Answer: true. Rationale: insulin pump users require frequent glucose monitoring to adjust dosing, preventing hypo and hyperglycemia and ensuring precise endocrine management. 225. Thyroid storm can cause hypotension. True or false? Answer: false. Rationale: thyroid storm causes hypertension from increased metabolism and catecholamine sensitivity, requiring beta blockers and antithyroid drugs for stabilization. 226. Acromegaly can cause sleep apnea. True or false? Answer: true. Rationale: excess growth hormone in acromegaly causes airway tissue growth, leading to sleep apnea, requiring pituitary treatment and sleep studies for management. 227. Insulin should be injected into the same site repeatedly. True or false? Answer: false. Rationale: rotating insulin injection sites prevents lipodystrophy, ensuring consistent absorption and effective glycemic control in diabetes management. 228. Addison's disease can cause weight loss. True or false? Answer: true. Rationale: Addison's disease reduces cortisol, causing weight loss from decreased appetite, requiring glucocorticoid replacement to restore weight and metabolic stability. 229. Patients with diabetes insipidus require low-potassium diets. True or false? Answer: false. Rationale: diabetes insipidus does not typically require low potassium diets, focusing instead on hydration and desmopressin to manage water loss and prevent dehydration. 230. Methimazole can cause hypothyroidism as a side effect. True or false? Answer: true. Rationale: methimazole can overly suppress thyroid hormone production, causing hypothyroidism, requiring dose adjustments and monitoring to maintain endocrine balance. 231. Diabetic retinopathy can cause blurred vision. True or false? Answer: true. Rationale: diabetic retinopathy damages retinal vessels, causing blurred vision, requiring tight glucose control and ophthalmologic care to prevent further visual loss. 232. The adrenal gland secretes growth hormone. True or false? Answer: false. Rationale: the adrenal gland secretes cortisol and catecholamines, while growth hormone is secreted by the pituitary, critical for accurate endocrine disorder management. 233. Hypothyroidism can cause fatigue. True or false? Answer: true. Rationale: hypothyroidism reduces metabolism, causing fatigue, requiring levothyroxine to restore energy levels and improve quality of life in affected patients. 234. Administering insulin to a patient with a blood glucose of 50 mg per deciliter is safe. True or false? Answer: false. Rationale: a blood glucose of 50 mg per deciliter indicates hypoglycemia, requiring glucose, not insulin, to prevent neurological damage and ensure patient safety. 235. Prolactinomas can cause vision changes. True or false? Answer: true. Rationale: prolactinomas can compress the optic chiasm, causing vision changes, requiring dopamine agonists or surgery to relieve pressure and preserve vision. 236. Hyperglycemia can cause polyphagia in diabetic patients. True or false? Answer: true. Rationale: hyperglycemia causes glucose loss in urine, triggering polyphagia to compensate for energy deficit, requiring insulin to control glucose and appetite. 237. Hypophysectomy can cause diabetes mellitus. True or false? Answer: false. Rationale: hypophysectomy may cause adrenal or thyroid insufficiency, but not diabetes mellitus, which results from pancreatic dysfunction, requiring distinct management. 238. Type 1 diabetes is associated with obesity. True or false? Answer: false. Rationale: type 1 diabetes is not typically associated with obesity, unlike type 2, as it results from autoimmune beta cell destruction, requiring insulin therapy. 239. Hyperparathyroidism can cause nausea. True or false? Answer: true. Rationale: hyperparathyroidism causes hypercalcemia, leading to nausea from gastrointestinal irritation, requiring calcium management to alleviate symptoms. 240. Cushing syndrome can cause buffalo hump. True or false? Answer: true. Rationale: excess cortisol in Cushing syndrome causes fat redistribution, leading to buffalo hump, requiring cortisol-lowering therapies to manage physical changes. 241. Levothyroxine can cause insomnia if overdosed. True or false? Answer: true. Rationale: excessive levothyroxine mimics hyperthyroidism, causing insomnia, requiring dose adjustments and monitoring to ensure endocrine and sleep stability. 242. Diabetic ketoacidosis can cause confusion. True or false? Answer: true. Rationale: diabetic ketoacidosis causes acidosis and dehydration, leading to confusion, requiring insulin and fluids to restore neurological function and stability. 243. Adrenal crisis can cause dehydration. True or false? Answer: true. Rationale: adrenal crisis reduces aldosterone, causing sodium and water loss, leading to dehydration, requiring hydrocortisone and fluids to restore volume. 244. A hemoglobin A1C of 6.5% confirms diabetes mellitus. True or false? Answer: true. Rationale: a hemoglobin A1C of 6.5% or higher confirms diabetes, guiding management to prevent complications and ensure long-term glycemic control. 245. Hyperthyroidism can cause palpitations. True or false? Answer: true. Rationale: hyperthyroidism increases cardiac output, causing palpitations, requiring beta blockers and antithyroid drugs to stabilize heart rate and endocrine function. 246. Patients with diabetes insipidus have high urine-specific gravity. True or false? Answer: false. Rationale: diabetes insipidus causes dilute urine with low specific gravity, requiring desmopressin to concentrate urine and prevent dehydration complications. 247. Type 2 diabetes can cause weight loss initially. True or false? Answer: true. Rationale: early type 2 diabetes can cause weight loss from glucosuria before diagnosis, requiring lifestyle changes and medications to restore glycemic control. 248. Hypothyroidism can cause hoarseness. True or false? Answer: true. Rationale: hypothyroidism causes vocal cord edema, leading to hoarseness, requiring levothyroxine to reduce swelling and restore normal voice function. 249. Administering desmopressin can cause hypertension. True or false? Answer: true. Rationale: desmopressin increases water retention, potentially causing hypertension, requiring blood pressure monitoring to ensure cardiovascular safety in treatment. 250. Cushing syndrome can cause easy bruising. True or false? Answer: true. Rationale: excess cortisol in Cushing syndrome weakens skin vasculature, causing easy bruising, requiring cortisol-lowering therapies to improve skin integrity.